Hi, I'm Madison Sloman.
Hi, my name is Katelyn Fenik.
Hi, my name is Madison Balsinger, and we are all students within UC's College of Nursing. We completed our Capstone project on education for nurses on preterm birth among Black women. The inspiration behind this capstone project came from a course named Vulnerable Populations that is an elective for the curriculum for the BSN program at UC. One of the core concepts of this course are racial disparities that exist in healthcare and how these health outcomes impact the community. The CDC states that in 2019, the rate of preterm birth among African American women was about 50% higher than the rate of preterm birth among white or Hispanic women. This fact prompted our group to find out more about why Black women suffer from these high preterm birth rates. It was found throughout our research that even with holding other factors constant, such as education, insurance status, marital status, and income, Black women's preterm birth rates are still higher than their white counterparts. The explanation behind these rates can be attributed to historical and generational context, Black women's lack of trust in healthcare due to previous encounters, unconscious bias from healthcare workers, and allostatic load and the stress on Black women. During our research, we found for historical and generational context that infant mortality was very prevalent on plantations due to lack of attention to the infant because of their mothers' seemingly endless work schedules. The infant mortality rate among enslaved people in 1850 was twice that of whites, and less than 2 out of 3 Black children lived to see the age of 10. In addition, a New York hospital targeted and gave unauthorized hysterectomies to Black women in the 1970s. Although at this time, hospitals had no policy requiring informed consent, these incidents have led to a lack of trust in healthcare that still exists today. Black women are more likely to report unfair treatment and discrimination within the healthcare system than white women and Latino women. Bias in healthcare is not a new issue, but is clearly an important point in reducing preterm birth for Black women. There was a study done in 2016 in which medical students believed that Black people felt less pain and they felt it differently than white people, which has led to a difference in response to pain and treatment. Lastly, and very importantly, there is evidence suggesting that due to racism and stress over time, there is a physiological response known as allostatic load that leads to a higher risk for many adverse health conditions or events. Acknowledging these stressors and hardships is paramount in providing adequate patient care.
While conducting our research, some strategies we found to reduce preterm birth were progesterone treatment, smoking cessation, and access to prenatal care. We also found that multi-level interventions are necessary, and the table above gives examples of the different levels and their interventions. Our PICO question was, are nurses who care for hospitalized pregnant women who receive education on the impact of racial disparities on preterm birth compared to nurses who do not have better knowledge on the impact of preterm birth due to racial disparities? Our intervention included an educational session for L&D nurses at Mercy Health Fairfield. We also did a pre-test and post-test via SurveyMonkey to collect the data, and we liked that because it was confidential, compact, and timely. Some challenges we had were working together through virtual meetings and a limited number of nurses to present the presentation due to COVID guidelines.
The population that was included in our education session were 10 labor and delivery nurses at Mercy Health Fairfield. The questions for our pre-test and post-test were identical. The questions were knowledge-based and were addressed in our presentation. 100% of nurses rated their knowledge about preterm birth in Black women higher after our presentation than before our presentation. 100% felt more confident recognizing indicators for preterm birth and using resources and strategies to prevent preterm birth in Black women after our presentation. In conclusion, all answers were improved during the post-test, indicating that the intervention was successful. There is a need to educate nurses about racial disparities in preterm birth in order to improve health outcomes. In order to see more information, the PowerPoint presentation for the intervention can be viewed by scanning the QR code on this slide.
Listed below are the references that are used to create this presentation. Thank you for taking the time to listen to our presentation. As we enter the nursing field, we are committed to continue bringing awareness to racial disparities and the role that they play in preterm birth.